Welcome to Cultivating Men of Distinction, addressing the social determinants of health for Black boys, Part 2. On behalf of the All of Us Research Program and Phi Alpha Fraternity Incorporated, we welcome you. Please watch this short video.
What lies inside all of us is more than data, it's life. What's flowing through America's veins is its diversity. And it's those very differences that will lead to answers for generations to come.
The pre-activity assessment is given to attendees or participants of CPGI activities to establish baseline understanding of research and the All of Us Research Program. The assessment takes individuals approximately 2 minutes to complete. So take out your phone or scan the QR code. Once you do so, you'll be asked your host organization's name, and that name is the Black Greek Letter Consortium. This presentation is an overview of the All of Us Research Program. Good evening. I'm Eric Christopher Webb, Brother Eric Christopher Webb, and I bring you greetings from the Black Greek Letter Consortium and the All of Us Research Program. What is health research? Health research is to understand, the first step is to understand the concept of health research. Research is the process of finding out new things. Health research is the process of finding out new things about improving people's health care. Did you know that the majority of health research has been conducted with middle-aged Caucasian men as the participants? That means the medicine or treatment resulting from the research is designed specifically for that demographic. Communities who are underrepresented in medical research then are at risk of experiencing negative responses because it is not the best for their body. Going forward, we need to do a better job of including all types of people in health research. The only way we can fix this injustice is with your help. So, what is the All of Us research program? All of Us is a program led by the National Institutes of Health that's working to improve healthcare through research. Now, unlike research studies that focus on one disease or a group of people, All of Us is about building a diverse data set that can inform thousands of studies on a variety of health conditions. It is a longitudinal effort to gather data from 1 million or more people living in the United States to accelerate research and improve health by taking into account individual differences in lifestyle, environment, biological makeup. All of Us is the largest and most inclusive of health research programs ever. Precision medicine. We're all different, right? But when we go to the doctor, our treatments are often the same. Your health care and treatment should be tailored for you. This is called precision medicine. Precision medicine is a new approach to improving health, treating disease, and finding cures. It acknowledges that a one size fits all approach to medicine isn't the best because we know that what works to treat me may not work to treat you. Each person is different. Factors that greatly impact our health are our genetics, our lifestyle, and our environment. Ultimately, precision medicine can produce more accurate diagnoses, earlier detection, and better prevention strategies and treatment choices. Here's some examples of precision medicine: prescription eyeglasses, blood transfusion, insulin pump, hearing aid. Social determinants of health. A growing body of research shows that centuries of racism in the United States has a profound and negative impact on communities of color. The impact is pervasive and deeply embedded in our society, affecting where one lives, learns, works, worships, and plays, and creating inequities in access to a range of social and economic benefits, such as housing, education, wealth, and employment. These conditions, often referred to as social determinants of health, are key drivers of health inequities within communities of color, placing those within those populations at greater risk for poor health outcomes. So here's the part where you become true participants. Pull out your phones and go to your Google Play or Google App Store and find the All of Us Research app. Now, be sure it says All of Us, it's the All of Us Research app. Visit the All of Us website at joinallofus.org/together. There you can learn more about the program or choose to sign up if you are ready today. Or, as I mentioned, you can download the All of Us Research app in the Google Play or Google or Apple app stores. Now, you may notice there are two All of Us apps in your app store. Please be sure to download the one named All of Us Research with the all white background, created by Care Evolution. Now, for those who are joining us tonight from the New York area, you can click on the link that's in the chat and learn about the New York enrollment process. Please note that the All of Us app can be downloaded on your computer, phone, iPad, or tablet. Now, here's about the enrollment and next steps. Once you've created your account, you will be asked to give your consent. This includes reviewing a series of videos, which will provide more detailed information about the program. These describe all the types of information you may be asked to give. Once you feel comfortable that you know what to expect and you are ready to give your consent, you'll electronically sign the consent form. You can do all of this from your computer, tablet, or smartphone, or at a partner center. You may also elect to share your electronic health records, which is a digital version of your medical chart, and complete the consent to get DNA results. You will be asked to answer several health surveys in combination with other health information. The answers provided in these surveys can help researchers identify patterns about how our lifestyle and background affect our health. After these initial steps, you may be asked to share your physical measurements and provide some your biological samples so that the program can help researchers better understand how different factors, including our genetics, make our participants unique. Now, here's the call to action. If you are in the New York area and want to know more about the enrollment process, please click on the link that's in the chat. So also go to the site and locate the Join Now button to create that account, or know where to come back to when you're ready to become a partner. MSRS. Now, on March 31st, 2022, the Minority Student Research Symposium, MSRS, invites students who are members of communities underrepresented in biomedical research to complete a research project of their choice using data from the All of Us Research Program Research Hub. Students will be paired with a STEM industry mentor to prepare a research project and present it during the virtual symposium. Greater participation of all racial and ethnic groups is needed in biomedical research. URMs represent over 30% of the US population, but less than 9% of STEM PhD members and 7% of all physicians. We know that diversification of the biomedical workforce will help address the critical need the US faces to reduce racial and ethnic health and healthcare disparities. At this moment, I'd like to introduce our moderator for tonight's webinar, and that is Brother Arthur Gregg. Brother Arthur Gregg is the owner and CEO of Gregg Training and Consulting, LLC. He recently retired as the Assistant Vice President for Multicultural Affairs and founding director of the Multicultural Center at the University of Texas at Dallas. He was responsible for the Multicultural Center, as well as diversity initiatives, trainings, and cultural competency programs for the UTD campus. He is also past president of the Texas Association of Black Personnel in Higher Education, TABPHE, and a graduate of Leadership Richardson. Gregg also serves as a co-lead facilitator for the Leadership Shape Institute. Gregg serves on several community advisory boards, such as Project Still I Rise and the Precious Heart Foundation. He is also one of the creators of and serves on the steering committee for the Aiming for the Stars African American Male Academic Bowl, which is in its 12th year. Brother Gregg is known for his presentations and workshops on topics ranging from leadership and leadership development, diversity, equity and inclusion, the multi-generational workforce, college readiness, recruiting, and retention of underrepresented minority students. He received his Bachelor's of Arts degree from the University of Houston and a Master's of Education in Higher Education from Dallas Baptist University. Please welcome Brother Arthur Gregg.
Good afternoon, or good evening, should I say, and thank you, Brother Webb, for that introduction. Thank you all for joining us tonight for part two of our two-part series. If you missed part one, we discussed healthcare access and quality, social and community context and neighborhood, and built environments. Tonight's topics are education access and quality and economic stability. So at this time, I would now like to introduce you to Frater Nassim Ashford, who will give us an overview, and better understanding of the concept of the social determinants of health. A little bit about Frater Ashford. Frater Nassim Ashford is a native of Atlanta, Georgia, and is a current and MPH student candidate at the Yale School of Public Health, concentrating in social and behavioral sciences. Frater Nassim received his Bachelor of Arts degree in Global Health and Global Development Studies with a minor in anthropology from Mercer University. After graduating, he participated in the Congressional Black Caucus Foundation's Emerging Leaders Internship Program in Washington, D.C., where he served in the office of Representative Karen Bass. Currently, he is in the CDC's Public Health Associates Program, PHAP, where he conducts COVID-19 infection and disease surveillance for the Richmond City and Henrico County Health Department. Frater Nassim is passionate about health advocacy and education, minority health, and health policy. He plans to pursue a career working both domestically and internationally to improve healthcare practices and promote overall health equity for those in need. Please help me welcome Frater Nassim Ashford.
Thank you for that warm introduction. Again, my name is Nassim Ashford. I'm a current MPH student, Master's of Public Health student at Yale School of Public Health, studying social and behavioral sciences. And I'm a member of Omega Phi Fraternity Incorporated, where I cross at the mighty Gamma Zeta chapter at Mercer University. Today, I'm here to discuss the importance of social determinants of health in regards to Black men and Black boys, but everyone. Next slide, please. So first, I'm going to talk about what is health and what are the social determinants of health. And then the next thing is the 5 domains of health. And lastly, why social determinants of health matter. So according to the WHO, the World Health Organization, health is a complete state of mental, physical, and social well-being, and not merely the absence of disease or infirmity. So what are the social determinants of health? By definition, social determinants of health are conditions and places where people live, learn, work, and play that affect their overall health and quality of life. Examples of social determinants of health include housing, community, access to health, childhood experiences, employment, social support, education, and family income. These factors affect our everyday lives. Therefore, everyone is impacted by social determinants of health in one way or another. These factors also make up the 5 domains of health, which are the neighborhood and built environment, healthcare access and quality, social and community context, economic stability, and education access and quality. This graph here shows the percentages of factors that impact an individual's health. 40% is attributed to socioeconomic factors, 10% is attributed to physical and built environment, 30% is attributed to health behaviors such as diet, exercise, sexual activity, and alcohol use. And lastly, 20% is attributed to an individual's access to health care. Next slide. The first domain of health is the neighborhood and built environment. It reflects the connection between where a person lives and their health and well-being. It includes key issues such as access to healthy foods, quality of housing, crime and violence, and environmental conditions. Neighborhood and environmental barriers affecting health include access to parks, lacks of transportation, food deserts. Lastly, housing barriers affecting health include poor water quality, poor air quality, lack of air conditioning and heating, and structural issues such as vermin, water leaks, and mold. The second domain of health is healthcare access and quality. It reflects the connection between a person's access and understanding of healthcare services and their health. It includes key issues such as access to healthcare, access to primary care, and health literacy. For example, the impact of healthcare access and quality can be seen through the differences in life expectancy. This graph here from the National Center on Health Statistics looks at life expectancy at birth for all men and more specifically the differences between white men and black men. African American males have the lowest life expectancy and highest mortality rate among all other racial groups within the United States. In 2017, the average life expectancy for all men was 76.1 years old, and for white men, it was 76.4 years old. And lastly, for black men, it was 71.9 years old. This shows us that in 2017, there was a 4.5-year difference in mortality between black men and white men. As you can see, looking at the data historically, Black men have had a lower life expectancy than their counterparts. This can be attributed to factors such as lack of insurance, provider availability, cultural competency, and medical bias. These factors determine the quality of care an individual receives and is often impacted by race. The third domain of health is the social and community context. It reflects the connection between where a person's social environment, such as their social support, family structure, and community engagement, and their overall health and well-being. It includes key issues such as incarceration, racism and discrimination, mental health, and stress. For example, Black boys make up 1/3 of the US incarceration rates. And in a broader context, today, Black inmates make up 40% of the US population compared to only being 13% of the US population. The criminalization of Black boys due to racism and discrimination leads to increased instances of police brutality, and over time, these actions affect the mental health of Black boys and their self perceptions of themselves. These factors disproportionately affect Black boys and men as and their health as they become adults. The fourth domain of health is the economic stability. It reflects the connection between a person's financial resources, such as their income, cost of living, and social economic status and their health. Economic stability can affect factors such as access to healthy foods, educational attainment, housing quality, and emergency resources. This graph shows the national earnings disparities relative to white workers in the United States. According to the data, Black households per dollar earning is 76 cents compared to $1 for white households. This income disparity that Black households face contributes to poverty, housing instability, and increased stress. The fifth domain of health is education, access, and quality. It reflects the connection between where a person goes to school and their overall health and well being, goes to school and quality of school. Health benefits of education include better jobs, higher earnings, reduced stress, better resources for good health, and increased positive social networks. People with higher levels of education are more likely to be healthier and live longer. So, why does it matter? African American boys and men are among the most underserved populations in the US in regards to healthcare quality and healthcare services, as well as receiving mental health services. Previous and current studies relating to African American men often focus on individual health behaviors and do not take into account the social determinants factors affecting their health. Addressing social determinants of health is an important factor in improving health and reducing disparities in the Black community. And lastly, with all of this in mind, it's important to understand that social determinants of health impact us all, and we have to be mindful and cognizant when we go to see our doctors and interact and express and understand our health completely, therefore that we can live healthier lives.
Wow. Wow. Dee, thank you. Thank you so much for that amazing presentation, Freda Ashford. Now I have the pleasure of introducing tonight's additional panelists that we have. First, we have Brother Nakia Douglas. Nakia Douglas is the founding executive director of TRIO and pre-collegiate programs at UNT Dallas. In this role, he works collaboratively with members of the university, school districts, business, and local community to create engaging, non-traditional educational experiences for students throughout the DFW area. Prior to his current work, he served as the executive director of the South Oak Cliff feeder pattern in DISD, or Dallas Independent School District. Additionally, Nakia is the founding principal of the Barack Obama Male Leadership Academy, a 24-year K through 16 educator. He has served students and communities from North Carolina, Georgetown, Centerville, and Dallas, Texas, that is, as either a teacher and or administrator. Nakia graduated from Lincoln High School in Dallas, Texas, which is a part of DISD, received his Bachelor of Arts in Elementary Education from Livingstone College, and Master's in Instructional Technology from Houston Baptist University. He and his wife, Gloria, are both career educators and have 2 children. Next, we have Frater Danny Harvey. Danny Harvey is the director of the financial planning program, finance instructor, and the College of Business at Prairie View A&M University. He has over 19 years of financial industry experience. Also, he is a professional speaker, has a great TED Talk, and has appeared on several radio programs and podcasts, as well as host of other venues to reach educators, parents, working professionals, entrepreneurs, and youth. In his spare time, he mentors youth, promotes education, financial literacy, and serves on nonprofit boards. Danny enjoys training college students to counsel and teach financial literacy to their peers and youth. Danny has an undergraduate degree from Texas A&M University in College Station and a master's of business administration from the University of Houston. He is a member of Kappa Alpha Psi Fraternity Incorporated. The native Houstonian, is the husband of LaWanda and proud father of Danny and Dylan. So welcome to all of our panelists. We're glad to have you with us tonight. And so for our audience members who are out there, please put all your questions and comments in the chat and we'll address them during the question and answer portion of our program. So let's get down to the good stuff. Well, let's start out, and this is going to be for all. So you'll also get to hear more from Frater Ashford as well. What are some of the current challenges of addressing disparities that you see in your community? And we're going to start with Brother Douglas, and then we'll go to Frater Harvey and then Frater Ashford. Again, the question is, what are some of the current challenges of addressing disparities that you see in your community?
Good afternoon. When I think about that question, when we talk about some of the current challenges, these are challenges that we've always been conscientious of in regards to lack of access, exposure to all of the components which Frater Ashford spoke of, specifically even more so when we think about perception in regards to our communities. Whereas there's a perception that now our communities are, in so many words, being colonized by way of the gentrification that's happening. We have to be conscientious of that. What does that look like to the residents, but more importantly, what does it look like to our society? COVID-19 and God shut down the world for this moment so that we can see ourselves, diagnose ourselves, and make a change. And so the ultimate solution, the answer to the problem is a solution that we have within us, is that we take ownership of our communities, our children's education, our health and well-being.
Great. Thank you, Brother Douglas. Frater Harvey, same question.
So, I mean, obviously, I agree with Frater Douglas. It's about the access to opportunity and exposure, right? Opportunity and exposure is what's going to drive a person to, succeed or know what they're capable of or what they can do. And those disparities continue to exist. And then obviously in education, uh, the social determinants, health, access to food. So we still see those disparities. Obviously, some in the community can look for avenues outside the community, whether that's education through different schools or things of that nature, but still try to give and provide to their community to uplift the whole group is, where we get there, right? You can, look outside and maybe if you have the opportunity to access other avenues, bring that back to the community so that we all can rise.
Awesome. Thank you. Fred Ashford, same question.
I definitely agree with everything that has been said thus far. I feel like one of the biggest challenges is the lack of access to quality services, especially when it comes to food, when it comes to education, and when it comes to medical services. A lot of our communities are within food deserts, which decreases our capacity to eat healthy foods, which therefore impacts our physical bodies, our mental bodies. So when we go to school, you're not able to perform as well. So I think that these factors and really just thinking about them, you have to take like a multidisciplinary approach in order to encompass everything and how it's all interacting with one another.
Yeah, good stuff. So, Brother Douglas, from an education standpoint, um, there's several questions in this question. What are some of the trends concerning Black boys and college preparedness? In urban schools, are Black boys being steered away from academic curriculums and toward trade and vocational programs? And what can we do to prepare, protect, and propel them?
As you said, that was a multifaceted question.
Yeah.
And I'm ready for it, honestly. When we think about the trends in regards to um, our Black boys within schools, first and foremost, again, perception. Our young men are not to be feared. Our young men are not to be demonized. Our young men are meant to be lifted up, praised, guided, and developed just like any other student within our schools. And so you see a lot of moves and trends in regards to school districts opening up equity offices where they're studying their policies. That is one of the first steps. But the other steps are us recapturing and demanding excellence within our schools. As a former campus principal, we were and always remain intentional in regards to the exposure of educational opportunities that we provided for those young men and young ladies. In my role now as an out of school provider and supporter of public education, I'm intentional with providing non traditional experiences that expose our students to activities beyond what they may have, not only in their schools, but in their communities and in their homes. If collectively we take that holistic, multidisciplinary approach, we don't miss anything. When we think about within our urban schools, whether or not our young men are being steered away from the academic curriculum and more towards the trades and vocational programs, it goes back into that old challenge and battle between W.B. Du Bois and Booker T. Washington. Uh, in the end, when we expose our young men and all students in general to these opportunities, there should be an opportunity for them to choose. But when something is force fed into them and they're having to choose a collegiate track at eighth grade as to this is what I want to study for the next 4 years in high school, and this is the major that I'm choosing in college, that's disingenuous to our communities. That's disingenuous to our students because any of us know that at the age of 13, 14, 15 years old, we're still trying to figure out what we want to do with the rest of our lives. And so while I support the collegiate academies, I am also conscientious that that's an early time to make a decision. And so we have to educate our parents and students even earlier. When we think about the academic tracks, our parents and schools need to demand that pre-AP and AP level courses be available. We need to not shy away from international baccalaureate courses. The more well-rounded our students are, the more exposed they are, the higher the expectations for them, our students can rise. And then finally, your last question was, what can we do to prepare, protect, and propel our young men? Be intentional, be purposeful, be present, ask those questions, demand those answers, and more importantly, create and maintain that village environment for our students where we have those trusted individuals and leaders throughout our community, within our schools and beyond, that are guiding them toward the right direction. And for those that may not have those persons, be sure that we educate, advocate, and lead those other persons within our sphere of influence as well.
Yeah, that's on it, man. Freda Harvey, I'm going to shift it, but I'm going to ask you a part of that question too. How does financial literacy affect the lives of these boys, and what are ways that we can effectively engage Black boys in this concept of financial literacy? Again, this is a multifaceted question, so there's a lot in there. And then how does it connect to their health?
Okay. I love what Frater Douglas had to say. It was, like I say, spot on. As it relates to financial literacy, or as I like to say, financial education, it's paramount. We see, the numbers we're rising as far as African American men going to college, right? Obviously, the numbers aren't where we want them to be, but more are going in our community than before. But we don't see any increases or a catch up in the wealth gap. So what is that saying? That's saying we're getting degrees, we're getting the jobs, but we're not managing our money effectively. And part of that is, in some cases, lack of knowledge, but it's also in the mindset or the psychology of the household a person may have grown up in. Right, that's going to affect also financial decisions. The studies are showing more and more that people don't always behave rationally, right? And again, that's nothing new, but as it relates to financial education or what to do with their money, people are learning or hearing what to do, but sometimes what's stopping that is the perceptions that they have, or the things that they were taught or they witnessed in their household that may affect whether they're willing to trust a financial advisor or financial planner. As Frater Greg stated, I run a financial planning program at Prairie View, and the profession, like many professions, is starving for young people of color, and women. I know we're talking about African American boys, but again, the profession is starving for African Americans, but it's foreign, or it's not common to hear that profession talked about amongst boys, because again, it's not most people don't grow up in a home where they see their parents or hear their parents talking about, we're meeting with our financial advisor today to talk about your college fund. It's about, you're going to college and we'll fill out those scholarships, versus having a true plan of how to put money away. And so, that in itself, the fact that many African-American boys are going into debt to get a college education, that in itself is an issue, because yes, you have a degree, but if you had to take out loans, be it unsubsidized or not, it's still going to impact when you look to lay out your budget of how you're going to spend your money. When one gentleman doesn't have to worry about student loans, so he can maybe take a job with less pay for a bigger upside, versus African-American boy taking a job that says, well, I got to make as much as possible and maybe forego the opportunity to make greater later. So that in itself, that financial education or that background or exposure hurts a person when they look to choose their profession, which again, when you talk about financial literacy, it starts with, what do you make initially, right? How are you going to divvy up that pie? The bigger the pie, the more slices you can have, right? So that's one thing, obviously. The other part of your question, on ways to engage. So there's a lot of ways to do it, because again, it's a mindset, it's a thought process. So if you're, if you have African-American boys at a robotics camp and you talk about how to, start your own business, that's going to help them be financially literate, to think about, ways to not just work for somebody, but I can create this and I can monetize this myself. If you're talking about, boys at a basketball camp or a football camp, you can impose some financial literacy there, or some sessions there to engage them on things around the sport, but also ways to engage the sport if you're not playing it, right? So that way you have their attention to something they're already interested in, but to show them different avenues of ways to monetize what they love, but also how to manage that in the same sessions. And then lastly, how it impacts their health. Well, again, when you talk about your health care and the things life insurance and the proper insurance to protect your assets, protect your greatest asset, your body. Obviously, the more resources you have to do that, the better your health will be, your eating habits, because again, that's all tied to your financial resources, right? The 99-cent menu is popular because it's 99 cents, whereas the grilled chicken is going to cost more, right? So again, if you're penny pitching and you're thinking about now and not later, you're thinking, well, let me get on the 99-cent menu, but obviously going to pay for it later with your health, and doctor visits, right? And so again, those topics or those sessions given or lessons given to African-American men, boys, as early and as often as possible are paramount. I always liken financial literacy to the gospel, right? Again, obviously the gospel is paramount, who Jesus is, but we say sometimes because we're either planting the seed or we're watering the seed. And that's got to be the same thing with financial literacy, financial education. We got to keep watering, or in some cases plant it, but continue to water, and then we'll see the harvest.
Yeah, that's you say, and now is financial literacy and financial education just interchangeable, or is there some difference in?
It's just more of a, for me, it's just more of a preference. I like to say financial education, because when we talk about literacy, because it's almost, because sometimes it, but it's just put it into action, right? And so that's why I always want to say, because people know it, like, you're educated, you have the education, but now let's put it into action. So it's just more of a peeve of mine, but yes, it's interchangeable.
Awesome. Thank you. So Freda Ashford, you've gotten your college degree, and now you're working on this master's degree. And conversation you talked about a PhD. Why are you so focused on the social determinants of health as an area of study? And is there one area that maybe grabs you most, or is it all five?
Thank you. So honestly, I've always been interested in health. When I first went away to college, I was majoring in biology or biomedical engineering. I thought that I wanted to be a doctor. Not that it's out of the question now, but I thought that I wanted to be a doctor, and I was taking these biology classes, learning about the body and cells and all kinds of medical stuff. And my questions that I felt of, like, what is health, they still weren't being answered to me. And so I took a intro to global health class, and in the class I learned about social determinants of health. And as I went down through each of the domains that you saw, I just kind of sat and thought, like, for each of those domains, I saw how it could be applied to not only my community, but my own family. And so when I started thinking about my family and how all of these factors outside of our control really was impacting our health and just our overall life and quality, and it just caused me to get more interested. So I started doing research on the community, research on in the water quality by a river by my house, and just looking up stuff that affected my community per se. Exactly, I'm from DeKalb County, Georgia, in Atlanta. It's like Metro Atlanta on the east side, and I really just started focusing on my community there. And moving forward, I learned more about social determinant of health and all of the factors. So you asked me, am I interested in just one? It's almost, that's an impossible question, because they're all mixed in together so much that it becomes a thing where in order to look at one, you must look at the other. And so I feel like in just moving forward, social determinants of health is really just a vital thing. And it's not a new lens, but it's a lens that hasn't really been applied in the terms of health and life and overall quality of life. I feel like moving forward, this is something that more people are going to start to look at and just help improve our communities overall.
Awesome, great, and thank you for sharing, man. I mean, you are the future, and if we don't do it now, then when do we do it? And so we appreciate the work that you're doing. And for our audience, for those who are watching, put your questions in the chat. We love to hear your thoughts. I'm sure you have some questions on some of the things that you've heard so far. And so we have these great panelists here. A couple of them are fathers of Black boys. So, a lot of it's going to come from personal experience and professional experience. And so with that being said, Brother Douglas, how can schools, colleges, and universities create optimized spaces for the social and emotional development of Black boys?
It goes back to our entire conversation in regards to not isolating one component of a child's well-being and their health. So within my role now, I have the opportunity of working with ISDs, our university, other universities, community college district, local business persons, communities, and families in a variety of formats, either federally funded, state funded, and or local family foundations that want to fund and build and develop programs that serve and support students or their families from a variety of the social health determinants. When we sit down and talk, we look at how we can holistically create something that's not just a one-off for those students and for those families. So for university personnel, ISDs, again, local business persons that may be on this call, persons from nonprofits, and parents, and just students in general, I said that you look at it holistically to address all the needs. A student can't learn if they walk into our buildings and they're hungry. A student isn't going to be focused on their learning if they know or don't know where they're going to sleep that night. A student can't be focused on their learning if they're worried about abuse within the home. When we look at a child beyond just test scores, when we look at a child beyond just the finances that come with them by being registered within our schools, but ultimately, if I can't feel this need, let me bring this community partner in and let me partner with this university. Then we are taking a whole look at that child. A child becomes a man, a girl becomes a woman through holistic development. And so when we embrace this, when we're conscientious of this, and when we intentionally bring all these systems together, then we can transform our communities.
So, a follow up to one of the things that I know you're proud of is being the founding principal of the Barack Obama Male Leadership Academy, which was a single sex, all male school. And so, if you would just share what went into your planning, what was your thought process as you were doing things like pulling your team together when you were thinking about curriculum and all that. What was your thought process in that?
Develop young men into impactful leaders through the development of their intellectual, moral, physical, and social skills for the global society of tomorrow. Beyond that, building better husbands and fathers and leaders for our families and community. Everything started and stopped with the mission statement in regards to it being the North Star of how we brought in and selected staff members, the curriculum that we sought to bring to the campus, and ultimately the pathway and or the vision that we had for all of those young men. When I look at Brother Nassim and other brothers just from the community, I know that there was that intentional growth and development holistically for him to be where he is today. I know his father. I know that sphere of influence and that village that was a part of that. When we were starting that campus, it took that same mentality. Although at the time, my wife and I didn't have biological kids, we saw every young man that came into that campus as a part of our family. We saw every parent that was a part of that as our brothers and sisters in regards to what we were doing collectively together to transform not only the lives of our young men, but more importantly, the community. So goes schools, so goes communities. And when we think back historically within our heritage as African Americans, our strongest schools, our leaders came from our communities. And there was that intentionality in regards to giving back to those communities so that they could see, feel, and touch what those leaders look like so that I could embody that in the future. That's what we brought to that campus. But again, it went back to that mission statement. It was that North Star that created a focus beyond my time at the campus, and more importantly, beyond the time of those young men's time at the campus, and it's had a resounding effect throughout our community ever since.
Great. Thank you for the work that you've done and that you're doing. Fred Harvey, when we think about economic stability, looking at issues like zoning, we heard a lot about how a lot of our communities and our being communities that are highly populated by African Americans are, their liquor stores, their check cashing, there's, a quick 2-piece and a pepper, the chicken shacks, and how so thinking about issues like zoning, how does the economic infrastructure of a community harm or help the health of Black boys?
Thank you. It's interesting you say that, about the check cashing and the payday loans and things like that, right? And one of the courses I teach at Prairie View is a personal finance course, and we obviously talk about loans and payday loans. And I always tell the students, hey, we're gonna talk real talking here. And so one of the things, first thing I say, because most, a lot of them business students in college of business, say, if you're a business person, where are you going to put your business? If you don't have a candy store, where are you going to put the candy store? Where kids are, where people eat candy. Same thing with the check cashing and the payday loans. They're going to put them where people use them. So first of all, I say that because it's, we got to empower ourselves, right? Obviously, we know there's predatory lending practices and things of that nature. So I'm not denying that fact. But we first have to acknowledge these are services we use. So why wouldn't they put them in our communities? Now, there's going back to Frater Ashford's points about the things being interconnected, there's reasons why we or families tend to go use these services and things like that because of, things that have happened or have been done to our communities. But we have to first acknowledge we got to stop using these things, right? I know it's not easy, and I'm not saying that, it's easy to do, but if we don't use these businesses, they go out of business, right? Or they change their location. So the zoning does matter, and there's predatory practices, but some of it or part of it, we have to take onus and try to, when we can't, again, educate ourselves and change our habits and our behavior. Because again, check cashing and payday loans, again, I know there's more to the question than that, Frater Greg, but that's just one of those things where we get preyed upon because we use them. Now, as we talk about zoning from like schools and where you go to school, again, that's the interconnected with Frater Douglas and his points about education and resources. Even in neighborhoods where gentrification happens, if you look at the demographics of those people moving in, they don't have families usually. There's kids that won't go to school in the community that they're gentrifying or that they're moving into, but it raises the taxes, right? And but the money, you don't really see it in the schools. It's not helping because one of the things I'll say, and this ties into that financial piece, is obviously resources important to a kid's development and success, but it's also parent involvement. So in these schools where you have, both parents are working, or you don't have that parent engagement to help the teachers, those volunteers, that's why a lot of those schools in the quote unquote good neighborhoods or good districts thrive, not just because of the resources, they have parent involvement. The teachers have help. The teachers get supported. And so those are some of the things that we lack in our communities where our kids have to go to school, where obviously they're lacking resources, books, but also lacking that extra support and help for the teachers from the community or seeing people that look like them. So anytime we have those programs where, it's, professional, bringing in professionals, right? Career day, and they could see people that look like them from a financial standpoint or financial education or building economics is huge because, again, when you have conversations as a kid, the micro view, talking about, well, what does your dad do? Or what does your parents do? Or what does your cousin do? When you can say, well, I see my cousin's an investment banker, or my brother is a principal at a high school, or does this, does that, that starts that dream in that child's mind of what they can do or what they can accomplish, what they can achieve, which obviously is going to tie in financially into the resources that they have and that they can share and give back to the community. So again, zoning and the way we're segmented does play a role. It does play a role, but I always try to preach the point of we got to raise ourselves. We got to help one another. We got to do it within to enact the change and be where we want to be.
And that's a great point when you talk about help. It takes all of us. It takes help. How do we engage? I saw in your bio when you talk about you like to work with college students to teach financial education literacy to their peers or to students. What are some of the tips that you give those college students? Because I know oftentimes I hear so many young Black boys talking about, coming out of different areas, talking about the hustle. Everybody has a hustle. What's their hustle? And having multiple hustles, and it's entrepreneurship. How do you connect all of that together? And what are some of the tips that you give when you're talking about creating financial literacy and helping our college students teach our youth about financial?
Sure. So when I started teaching at Prairie View, again, I was teaching, one of the courses was a personal finance course, and I realized the students weren't really ready for the information. They were hearing it, but they weren't ready to apply it. So I said, I got to get to them when they're younger. And so the thought was, I always say, being a noob, I'm cool, I'm fly, whatever. But to kids, I'm an old fogey, And so I said, if I bring my college students there to the high school or to the junior high, they still revere them. They have a certain admiration for them and respect. So I say, if I can get them to talk to the high school or the junior high students, they'll receive it well. Plus, it's hard for my college students to tell them to create a budget or create goals if you're not doing it. So again, as you know, Fred agreed, service learning. And so I feel like that, Paul and Barnabas relationship, Paul and Timothy relationship of, a bigger brother kind of teaching a younger one is effective, right? And it's better received because they're closer in age. Again, I'm always talking about, we talk about the hustle and the grind, in H-Town, we say, if you ain't grinding, you ain't shining, right? And so, I tell the kids that, but then also, that's how our society has evolved. We talk about the shutdown or even before that, the gig economy, right? Uber drivers or Uber Eats. And so, I tell them they doing what we doing. They talk about multiple streams of income. That's hustling, right? And so just making no connection with the terms of, again, multiple streams of income with hustling, more than one job or business, right? While you're going to school. Or things that, I talk about, because again, the more you make, right, it's important. I always say, how much you make is important, but what's more important is how you manage it. But I still want to make as much as possible, right, to divvy up amongst my goals, my dreams, my aspirations. So those are the kind of things I talk to or have the students talk to their peers or those below them about, so that they can connect. It's well received.
Great, thank you. Thanks for sharing that. And so Fred, I know you talked earlier about what kind of got you into the field of public health. What was the thing that connected you? Well, how do we we're having this conversation. How do we create opportunities for Black boys to get engaged in public health matters like neighborhood? We talked about the neighborhood. We talked about social contact. We talked about healthcare. How do we do that?
So I think first it would be just access to information and knowledge and things of the sorts. Personally, I was in the CDC undergraduate public health associates program. It's under the CDC Minority Health Office. And in that program, I basically went to the University of Michigan and studied public health at the University of Michigan over the summer, and was partnered with health department in Michigan and did public health work and did research on social determinants of health and such. And so I think it really just takes access to the knowledge and information of what's out there and what opportunities they can go down. Public health in itself is so broad, you can kind of find a niche anywhere. For those who are interested in the neighborhood and built environment, you can run for office or something like that. Where I went to the Capitol Hill and was in the CDCF Congressional Black Caucus internship. If you're interested in the nature and environment, I did an internship at the Nature Conservancy for global environmental practices and things like that, where I went to the forest for 2 months over the summertime and was cleaning trails and doing things like that. So it really just takes a stance of broadening your horizons and taking opportunities that, even though you may not see how it's going to benefit you at that time, you can see where you can apply it later on in life. And that in itself will help to promote your health and be involved within health matters.
Well, we should thank you for taking the leadership and the initiative to create that and to be engaged in that. It
Also,
sounds like you did
also,
some deep stuff.
yeah, I was going to say also with the public health, the CDC program for minority students, the application is due on January 31st. So people can apply. It's a consortium of like 5 different schools: Johns Hopkins, Columbia, um, UCLA, Morehouse, and University of Michigan. And the students, it's like an internship program. You get paid during the summertime and you get to work on different projects and present at the CDC.
Well, I tell you, brother, if you get a moment, if you can just drop that link in the chat, if you have it close to you, you can drop that link in the chat. I'm sure that it will be greatly appreciated. Definitely. So we have a question from our audience, and the question is, how can we narrow the technology gap / desert in schools to allow our young boys in the community to get the necessary resources needed to learn in school and home? And I'll just open that question up.
I'll jump out there first. The pandemic made a lot of people pivot in regards to access to technology within our schools and community. And actually, in the instance in regards to access, I think it provided 2 frameworks. First, that the bureaucracy within our school districts and or universities could be overcome with a sense of necessity, a sense of urgency. Secondly, it also pointed out again the disparities within the connectivity that was within and or without our inner city communities. With that being said, as this started, we need to make sure that we don't go back to the old traditional ways of learning, because we're dealing with a generation of students that have shown us they can adapt to whatever's being provided for them. And more importantly, as long as those expectations stay high in regards to the instruction that's delivered and also the technology that's available, the sky's the limit. When we think about how Amazon has transformed the world of business, we have to have that same mentality in transforming the world of education and what we're providing to our students as well.
Great. Thank you, brothers, Fratters, Harvey or Ashford. Any thoughts on that?
I definitely agree that access to technology and quality technology, Wi-Fi and all that is very important. I know a lot of cases where students were at home and they didn't have Wi-Fi and they weren't able to perform and do their schoolwork. Also, we need to think about the mental health of students as well too. Students were online for 2 years. Some of them became depressed. Some of them not logging on to classes, stressed out from all of the work they received from their teachers. This is in middle schools, elementary schools, colleges, everywhere. So I think we have to check in with the students and make sure that they're doing okay. And it's the technology is here now. You can meet with therapists. That's a good way to connect with a student emotionally and intellectually. Just have someone to talk to. But to just really just be mindful of all of the resources that are available out there in order to really help and get to know the students one-on-one.
Yeah. Fred or Harvey, any thoughts?
Yeah, I would just say, in this case, I'm going to take a different slant, different segment of the population. I'm talking about college students. As far as narrowing the technology gap and things like that, I think one of the things we have to do is kind of train and educate our boys to be advocates for themselves. They got to speak up, got to go get it. You know, at Prairie View, again, we talk about resources. Resources were made available for students to get laptops and things that they, you know, or Wi-Fi. But students didn't take advantage. Some students didn't take advantage of it, didn't go looking for the help. And so again, like I said, I'm definitely not one of those, that believes, there's not obstacles and things that we have to overcome. But some of the things, again, I'm going to go back to how we train and how we educate our boys to speak up and advocate for themselves, and don't just sit back and see what's going to be given to you. Go take it, right? And go seek out the resources that are needed, or then, okay, not what's not available. Now I know what I need to fight for, what I need to advocate for. If we don't have it, but times there are resources there, we just don't go take advantage of it. So different slant on it, but I just wanted to point that out as well.
Well, Fred Harvey, here's a question that's coming in directed towards you. Can you explain the importance for students to build positive relationships with banks?
Definitely, it's paramount. I talk to my students about always, or anybody I can get in front of, about building that relationship. You want a relationship with the commercial bank and the credit union, both. Obviously commercial banks provide the widest variety of resources for an individual, whereas, credit unions, nonprofit, going to get, better loan rates, a little better interest. We know, not much interest at all with banks, but it's about the access to capital. Right. And having that relationship. Again, obviously, we know there's, we're trying to get more access to VCs and things like that. But just a family looking to, whether it's an auto loan or something, you want to be able to have a relationship with a financial entity that spans over time. Right. That you can grow with, that they can watch you grow when you get your first job at 16. Because, again, as a person that promotes financial literacy and education, you need to work as soon as possible. Right. And again, every household is different. Your job may be going to school. So I'm not saying, you have to do, but I'm just saying you want to start what it feels like to earn a check so you can retire one day like Fred or Greg. But it's definitely important. We have so many, well, not so many, but, a lot of people are unbanked or, don't want to be, affiliated with banks or things like that, or want to go into the, the crypto space, and all that's great. Don't get me wrong. That's great. But traditional banking services, that's regulated, that's not going anywhere anytime soon. And so it helps with the credit, a possibility of a debit card and using that like a credit card. So just having those relationships is very important. The sooner, the better.
So what is too early to start your boy or your son or your nephew or our boys to work, to start them earning and really start teaching about the importance of financial education and literacy?
I tell you, man, I'll be honest with you. A personal story. As you know, I have two young boys, a fifth and a third grader. Man, they were going to school at our church, Church Without Walls here in Houston, and I was at a presentation. I heard about Lemonade Day. Didn't know much about it, but it's a process where the kids do a lemonade stand. So I sat down. At that time, my kids were in first grade and pre-K. And I sat down with them and we did Lemonade Day on Mother's Day at the church with, again, pre-K, kindergarten, and first graders. So at that age, they can learn, because, again, the program with Lemonade Day is about, setting your goal, earning the money, saving some, giving some, and then spending the rest. So that platform in itself was great. And the kids could identify with it. And again, it's planting the seed. Did they understand everything or every little piece of the different steps of goals and but it's the seed was planted. And now it can be watered when they see a kid with a lemonade stand or read a book about or drink, lemonade at Chick-fil-A. I can make my own lemonade and sell it and get my own money. So planting those seeds, watering it, you can't start too young.
Awesome. While you're on the mic, and Brother Douglas, I'm sure you can jump in. All of you can jump in on this. What are some ways we can bridge the gap between first generation college students and financial literacy?
First generation college students and financial literacy. Again, the mindset, right? Even in going to college, and again, I'm gonna take a different slant. Some people may not, agree with, but my first thing when I talk to students why are you going to college? Why are you going? I mean, you don't need it to be successful if we're talking about financially. Does it help? Yes, but it's just starting with that premise, because a lot of students or a lot of our boys, they go to school because they're told they have to. That's how you become successful. And yes and no. Obviously, I'm an advocate of education, but you got to be prepared for it, because when you get to higher ed and the cost of it is so expensive, I always paint the picture. If you come here and you're not prepared, you're going to be worse off than your friend who you thought you were doing better because you were going to college and they went to work at McDonald's. They may be better off financially than you because you're strapped with this debt. So the first thing I would say is, again, I know we want our kids to be educated. You want to see that degree on the wall, but you got to know it's college for you at this point in time, right? Because again, working for a couple of years and then going now because you grind it and you see, well, yeah, I want to get this degree and I know how I'm going to use it, can be effective. Again, there's different approaches, different, paths for different people. And we know now, obviously, again, my thing is the cost of higher education right now is so high, is that, again, it's a preparation process from when they're young to say, why do I want to go to college? How am I going to get the most out of it? How am I going to pay for it? So again, I hope that gives some light to the question, but that's the kind of, approach I want to take on my answer.
Great. Thank you. Thank you.
And to piggyback from Fred or Harvey, the earlier we can teach our young men, the better. And not only teaching them about financial literacy, but also about their purpose. And again, finding their why. What are you so, when as a campus principal, I would always ask the students, what are you so passionate about that you would do for free? And, they throw out everything. Well, I go into medicine, I do all of this and I do this. And I was like, why? They said, because, I love it. I said, when you find out what your purpose and your passion is in life, you may not make a lot of money within that field at first. But when you become that specialist and you become more entrenched and have that experience, you become that go-to person and potentially one of the best paid persons in that field. So when we think back even deeper to those first generation college students, Fred Harvey said we plant seeds and we water seeds. There's that other component even before that I learned during the pandemic. We've got to cultivate the soil. We got to make sure that those students, specifically our young men, are prepared for the lessons that we're trying to deliver. It's one thing for us to say, you go on to college, but we don't show them that path. We don't show them the essence of what it can provide to them. Or we tell them you're going to go into this trade and they don't see themselves within that. When you're cultivating that soil, which is their mind and their spirit, socially, emotionally, that will prepare them and propel them for success that they can't even imagine, because they know that Fred Harvey, Fred Ashford, Fred Greg believed in me in such a way that they trust me to follow my purpose and my passion. And whether that's going to college and or going into the workforce, I become an entirely different person because I'm fully engaged in my craft and I'm the master of my craft. And so therefore, my craft becomes my destiny, and my destiny becomes an outlet for not only myself, but also for that future generation coming behind me.
Brother Douglas, real quick, you said something earlier, and it has been sticking with me. You talked about not running from AP and pre-AP courses when we think about education, and we think about, and as we're just having this conversation about college and knowing your why is it important for our boys to be in these courses, to be to explore it, to run to them as opposed to run away from them?
What happens within a lot of our schools, specifically with some of our young men, they're labeled as disruptive. They're labeled as behavior problems, when in most instances, they're just bored. They're not being challenged. In most instances, they're not being engaged. When you get into those pre-AP and those AP level courses, they're going to be engaged because they're going to be challenged. And there may be some initial, I won't even say outbursts, but it's just some differences in their personality and other performances at first, because they have been so indoctrinated that this should be easy for you. Sit in the corner after you finish doing your work. You can draw, you can fiddle. But when they're engaged, our students don't lose their way. When they're engaged, our students will ask those questions. When they are exposed to something that really catches their the psyche, their mentality, that, okay, I never thought about astronomy because I didn't have a telescope growing up. but I met this professor or this teacher taught me about astronomy or taught me about the history of Africa and where we come from as descendants, and now I want to be a historian. When that happens with our students, it's transformative. And so when you couple that with those engaging pre-AP, AP level courses, Algebra 1 in 8th grade, which is the gateway math to all other forms of education for our young men and young ladies for that matter, then you're changing the entire paradigm. Then you are reigniting what's innately within them. A lot of what we're seeing with like a Frater Ashford was someone ignited something in him early on, and now he's thinking about a career that most of us were like, that's not for us. We don't do that in our community. No, it was that exposure. It was that igniting. It was that challenge that probably came through a pre-AP, a AP, a dual credit, and or international baccalaureate class that isn't acting white, it's acting right.
Yeah, yes, sir. Yes, sir. I'm sorry, I had to amen that. I like acting right, not white. Yes, sir.
I definitely agree with everything that you just said. I do think that AP and IB programs are important, but I personally feel like dual enrollment is even more important. Usually with the AP tests and exams, you have to take a test in order to say that you've reached a level of competency, and only then can you potentially get a credit at that school that you apply to. I think that with dual enrollment, it gives you the opportunity to really test your ability in school and actually make and get real credits in college. And so it could be a community college or even like a local university or something like that. So when you actually do go to college, you can take those credits and it'll be easier to be accepted. And I think that that exposure on just a collegiate level also helps to broaden the mind and see the different possibilities that you can experience while you're in school. So, like, yeah, basically.
Man, if I could piggyback that, Frater Ashford, I totally agree, because it gives you flexibility now if you want to study abroad and not, still graduate on time, pick up a minor, get a master's while you're there. That dual credit, I'm with you. It's the way to go. It's the way to go. I mean, AP is great, but to Frater Douglas' point, it's don't just do the bare minimum, which is what he's saying, which I get that. And it goes to the point I was trying to make too. And again, Frater Ashford, he went down the path of wanting to learn more once it was peaked. That was something that he was trained or he was taught to look beyond. And again, we got to give our boys the voice, have them advocate for themselves. Like, I'm not being challenged here. Let me speak and speak up for that. Again, obviously they're not going to do it at 5 and 6, but when they're 16 or when they're in college, they know not to accept any shorts. They know more. I can do more. I need to ask for more. So I think that that's important as well. Man, I'm getting pumped. I'm sorry, I'm getting pumped up, man. Y'all
and to both of you all's points, we were intentional with having the dual credit, AP, pre-AP as choices. And so as a 6th grader, you were understanding that the reason you're in these pre-AP classes is preparing you that if you want to go the AP route, you can do so. If you want to go the dual credit route, you can do so. If you want to do a combination, you can do so. And so within that campus, not only there at Barack Obama, but even actually before that, when I was principal at A. Smith, the students were educated to such a point where I want to stay in Texas. This is the route I want to go. These are the schools that would accept my dual credit. I'm going to make that choice. I want to look at opportunities outside the state of Texas. And I know if I go the dual credit route, this out-of-state school may not allow me to transfer those courses. This is why I'm thinking about AP. So when you educate the entire child, the entire family, the entire community, then you got options, and also you can demand those options within your schools.
I've heard this a lot about giving them the voice. What are ways that we can give them the voice? How do we give them the voice? We say it and we talk about it, but how do we physically, literally give them the voice?
It's talking to them. Again, where obviously it's easier with your boys or your cousin or your nephew, but if you're talking with a group of boys, it's those open-ended questions, for them to talk about how they feel and why and express, because that's part of it. Sometimes they don't get a chance to just talk and express how they feel, what they're thinking, and just having those intentional but free-flowing conversations, right? Because then they get a sense of, oh, somebody's listening to me talk. And then again, those little finer points of, look at a person when you're talking to them, with your head up, chest out, that confidence that builds them. Hey, I got something to say. Let me say it. Let me voice it. And somebody's going to listen to me. So I think, that's a way to do that.
Yeah, I definitely agree too.
Yeah. Well,
and likewise, creating platforms and spaces for them to have those moments. Sometimes as men, we're taught to hold things in. It's okay to have those honest conversations with our sons. It's okay to have those honest conversations with the younger generation, because they're trying to figure out, and in some instances, the same way we are. When you talk about first gen, I'm first gen, and there are accomplishments that I'm having now in life, just even being close to 50, thinking about, what retirement can look like. You never consider that, you were just initially as a student, as a young man, in survival mode. But when you're transitioning from surviving to thriving, and those areas in between there's that culmination of how I'm growing socially, emotionally, how I'm dealing with these new challenges. I never saw my mother and father married. So what does marriage look like, and how does my interaction with my wife impact my son and daughter and those that are within the sphere of influence? The learning doesn't stop. And so therefore, when we have those platforms where we're having this open and honest dialogue, like what we're doing tonight, that becomes that transformative factor that breaks cycles, that creates new tomorrows for our communities within our families as well.
Yeah. And I know we could carry this conversation on. And as we are wrapping up, I want to give each one of you a few moments to just share some closing thoughts around this whole concept of social determinants of health, whether it's from education to community or health, just to kind of wrap this up. And we'll go alphabetically, and we'll start with Frater Ashford.
Thank you for the opportunity to speak. I just want to say that I feel like conversations like these, platforms like this, and just the overall perspective and shift of changing and thinking about health in different ways is very important. And we must continue to do that as we think about our education, as we think about going to see the doctor, as we think about the types of foods that we eat. I feel like it's very important to keep all of this in mind and just be cognizant, because once you're cognizant, you're able to make the changes that are needed to improve yourself and those around you. Thank you.
Awesome. Let's see, Brother Douglas.
Again, to piggyback on what Frater Ashford just said, conversations like this, and that it doesn't end here, that all within the listening area and those that are online take these conversations back to their communities, take these expectations and learned opportunities back to their communities and to their families to create the change that we want, to demand the change that we want. And ultimately, it's kind of like our motto within our department: educate, advocate, lead. We're here to educate you all, that teach you to become advocate for yourselves and for others, and ultimately lead yourselves and others in your work. And so my challenge again with everyone listening this evening, and those that may look on later on, educate yourselves, become an advocate for yourselves and for others, and ultimately lead this next generation into the future.
Yes, sir. Yes, sir. Frater Harvey.
Mute.
I believe you're on mute.
Sorry about that. Thanks. I want to say first, thanks, Joy, sharing the platform with you gentlemen. Like I said, I'm pumped up, man. Y'all got me fired up. But I close with just saying, if we can all provide opportunity and exposure for our community, right? Anytime we can give opportunities to those who need it, right? Whether the opportunity is, a job a spot on a board, a spot wherever, that opportunity, try to provide it. And then the exposure, right? We got to expose, we got to share, the knowledge we're gaining, these conversations we having, we got to share it, right? And, obviously try to make it palatable, meet people where they are. But also the other thing, hold one another accountable, right? Hold one another accountable to raise the standard, right? Because, we got to help, right? But we got to teach. We can't keep giving fish. We got to teach the fish because we don't want to be enablers. Right. But again, thank you, gentlemen. I enjoyed, man. I'm fired up. I took some good notes, I think. So I appreciate you guys.
Well, we all got some good notes. And again, thank you all. Thank you to our panelists, to Frater Ashford for your work and your research in this awesome presentation. Thank you to Brother Douglas for the work that you're doing and just being a part of this panel. And again, to Frater Harvey, the work that you are doing and being a part of this panel. I also want to thank our team that pulled this together, the Alpha team for All of Us research program, Brother Bruce August Jr., who has run, he is the man that makes everything happen in the back. So he has been our producer, director, all of the above. And so I want to thank Brother Dr. Eric Webb for the work that he's done, opening up our program. He moderated our first session. We want to thank all of us research program, really for us being able to bring these programs to you and bring this program, and of course the support of the BGLC, the Black Greek Letter Consortium, because where there's number, there's strength, and we know that as we saw tonight, this program, it was number there. There was all of us in this together. So as we are closing out this program, we want to leave you with a couple of things. First off, we're going to give you a few moments. I know many of you did that pre-test. I hope you did the pre-test. But if you didn't, here's your chance. You can do the post-test. There's a post-assessment that we need to get that information from you. We know that this post-activity, again, similar to the pre-activity, gives us that baseline. So if you would just take a few moments to scan this QR code and fill out and complete the post-assessment, we would greatly appreciate that. We'll give you a few moments to do that. We also definitely want to thank those of you who have tuned in, tonight. Your questions, your support means the most to us. Feedback is definitely love, and we definitely need that and want that from you. If you did not get a chance to see the first part one, I believe it is out on YouTube. It's the same title, Cultivating Men of Distinction, addressing the social determinants of health for Black boys. And also we want to tell you about another activity, a program that we have coming up, and it's coming to the Dallas-Fort Worth area the weekend of February the 25th through the 27th. And it is the Rooted in Resilience Tour, which will bring college, community, and church together to learn more about All of Us research program and about health, being advocates of our health. And so without any other further ado, you will see the save the date for the Rooted in Resilience Tour that is coming to the Dallas-Fort Worth area. If you're in the area, we would love to have you participate. If there's nothing else, we again want to thank you. And we hope that you have gained as much as we have, and will continue to be in this conversation of how do we cultivate men of distinction by addressing the social determinants of health for Black boys. So thank you very much, and we hope you have a great rest of your evening.
What lies inside all of us is more than data, it's life. What's flowing through America's veins is its diversity. And it's those very differences that will lead to answers for generations to come.